flex a little bit, and you're just looking to mobilise it in all four directions. Okay, so medially, laterally, superiorly, and inferiorly. Okay. Alright. Video.
Yeah. What's the point?
Who's done the myofascial course here? Anyone? No. Okay, so if you ever do the myofascial course, I didn't show you this one, okay, because I believe it's on the advanced myofascial. Okay, but well worth doing as well. Doing some mobilisations, actually working in fascial release around that onto like the patellar ligament. If you move, because in theory, if you have a look at your kneecaps, okay, so in theory, okay, your kneecap there, okay, should sit there, okay, over the top of your tibial plateau, okay. This bit in between, which everyone got, is just a nature of our lifestyles, okay, and the fact that we sit with our knees like that the whole time and we think. So in theory, the closer we can get that knee to working down, okay, the more effective and the more efficient our body's going to be. Okay, that's a better position for it. Okay.
Is that PS? Is that a cure? Cure,
yeah,
you know,
can be. Yeah,
for PS
syndrome. Yeah, definitely. Not fix. A technique to utilise to maybe try
to ease it a little bit.
Exactly. Yeah. Okay. So the best thing to do, okay, is to grip onto the kneecap, okay, and to put your fingers in there, and then you literally want to mobilise the knee so it goes down in your left with a lot of tissue, yeah, but also a fair bit of fascia under there. So grip the edge, fingers down once you've pulled it down, yeah, and then you're going to sink in onto there.
So now you use.
So I'm going straight down at the moment.
Pressuring your fingers here.
Yeah, exactly. But I've already mobilised the kneecap inferiorly, okay, to get it back into the position it needs to be. Okay. Once I'm in that position, sink onto it, as you would do on any fascial release. Yeah. Then, once you're happy, yeah, change the angle, and then we're literally going to move fascially up the ligament towards the quads. Yeah. And eventually, depending on how far, and Andy's MTJ is quite low down, okay, so we're running into a huge amount of tissue quite quickly. But once you've done it a little bit, you'll find you have more movement down, and then you can actually repeat it and go back a little bit further, and you'll get a little bit more fascial release at the start, and you can keep working it. I reckon on most people's kneecaps, you can probably correct it to at least half the value that it is. Okay, and some people, see, Andy's actually not too bad, which is why there's not a lot of movement, because his kneecaps, so his kneecaps there, and his tibial plateau is there, so he's not got a huge amount. Okay, it's a fair bit of slight in between mine, definitely. Most people have got quite a bit of kind of loose tissue in and around under the knee, okay, which is effectively a vulnerable part of the joint. Yeah. Okay, straighten up. So that's a nice one just to throw in, certainly if you're doing sort of like patellofemoral syndrome or something like that. Yeah. Happy with that? Yeah.
Yeah.
The other ones you are probably well versed in. Okay, so I don't know what we've named. So we've got an anterior posterior glide, effectively.
Tibiofemoral glide.
Okay, so tibiofemoral glide, anterior and posterior. Okay, so forward and back. In that position, yeah. Okay. You've also, in theory, got your valgus and your varus stress tests as well. Okay, and if you want, you can just bend the knee up and just do it and just alternate it slightly differently. But remember, we're doing them as modes rather than just single movements. Yeah. So 10 oscillations into there, put it into a stress position, and then we're just moving. 10 oscillations, and then work on it.
So would you do that as a?
Yeah, you can do it like that. Yeah, you can do it like that. Both the same. Yeah, it's just whatever's comfortable. I tend to like to do the medial one, holding it, because then you can use your body weight rather than muscular strength. Yeah, but it's quite hard to do doing the lateral one. Yeah.
Tibiofemoral distraction. Tibiofemoral distraction, superior.
Okay, so yeah, so the distraction, okay, is just the pull.
Yeah.
Okay, just to pull. Make sure you are pulling over the top of the ankle and not under the ankle this time, okay? Because now we actually want to try and distract the tibia and fibula away from the condyles. Okay, so a little bit of stability over the top of the leg. It's not going to entirely stop any distraction up at the hip, okay, but it might just stop a little bit, okay? But we really want to focus in around the knee. So hold over there, stabilise, and then it's just torsion through, okay? Happy?
Yep.
Yeah, straightforward. Superior tibiofibular glide. Okay, so this is the one that we're showing on the course. So onto your side hand.
Which side in this one?
Either one will do. Yeah. Okay, so bottom leg bent, top leg out straight. Okay, and then it's onto the top of the fibula. Yeah. So from there, okay, and just push in anteriorly, which is the normal reaction for it. Okay, and then posteriorly if you can get it, okay, but it's quite difficult. Okay, so I'm not even going to bother attempting that. Randy's quite restricted through there, he's got quite good muscle. Maybe just get a little bit, actually, yeah, can get it. Okay, so come in posteriorly as well. You've got a little bit of movement, but there's a fair bit going anteriorly in there. Yeah.
What kind of issues would someone present with for you to do that?
Sorry, Ray.
What kind of issues would someone
So
present?
anybody with knee issues, certainly people with shin splints, yeah, so where they've got congestion in and around kind of anterior tibialis, people with Achilles problems, plantar fasciitis, because if you imagine they've got that tension up in like calves, gastroc-soleus, okay, it will congest all around these areas. Anyone that's presented on your special test with issues in the knees, yeah, so anything which is flagged up in terms of like a ligament issue, okay, where there's a tightness or either a laxity or a restriction, okay, it's worth de-restricting all the areas that potentially you could do. Yeah. Okay. In theory, a lot of these, any kind of condition in and around the area is going to be helped by doing these kind of things. They probably, in isolation, aren't going to cure anything, yeah, because they're so subtle. Okay, you might get lucky, and it might just kind of just be the thing which you need to trigger everything else working. Yeah. So everything on that list.
One more.
Valgus varus stress.
That's the one.
Oh,
That's the one we showed. Yeah.
So that's
is.
it. That's
Oh, gotcha,
That's
gotcha.
the, yeah. Okay, so you've seen all those pretty much before, yeah?
Yeah.
Do you want to have a go of them, or?